Dermatophytes are types of fungi that cause common skin, hair, and nail infections. Infections caused by these fungi are also known by the names tinea and ringworm. It is important to emphasize that ringworm is not caused by a worm, but rather a type of fungus called a dermatophyte. Trichophyton rubrum and Trichophyton tonsorians are two common dermatophytes. These two species are usually transmitted from person to person. Another common dermatophyte is Mycosporum canis, which is transmitted from animals such as cats and dogs to people. Dermatophytes like to live on moist areas of the skin, such as places where there are skin folds. They can also contaminate items in the environment, such as clothing, towels, and bedding. Dermatophyte infections are very common. They can affect anyone, including people who are otherwise healthy. Dermatophyte infections may be more common among people with suppressed immune systems, people who use communal baths, and people who are involved in contact sports, such as wrestling. Outbreaks of these infections can occur in schools, households, and institutional settings. The dermatophyte infection that affects the scalp and hair is known as tinea capitis. It is especially common among school-aged children. For reasons that are not well understood, tinea capitis does not usually occur after puberty. Other kinds of dermatophyte infections tend to be more common in adolescents and adults. Dermatophyte infections can affect the skin on almost any area of the body, such as the scalp, legs, arms, feet, groin, and nails. These infections are usually itchy. Redness, scaling, or fissuring of the skin, or a ring with irregular borders in a cleared central area may occur. If the infection involves the scalp, an area of hair loss may result. More aggressive infections may lead to an abscess or cellulitis. Areas infected by dermatophytes may become secondarily infected by bacteria. Symptoms typically appear between 4 and 14 days following exposure to the fungi. These are just a few things to know about dermatophytes. To learn more about infectious environmental disease testing services and prevention measures or other indoor environmental concerns, please visit the website shown on the screen. Candidiasis is caused by fungal pathogens from the Candida genus. Most infections are caused by Candida albicans, a type of fungus that grows both as a yeast and filamentous cells. The ubiquitous fungi represent one of the most common fungal pathogens to affect the human population. The fungi are the causal agent of opportunistic oral and genital infections in humans. In addition, systemic fungal infections due to Candida albicans represent an important cause of morbidity and mortality in immunocompromised patients. Hospital-acquired infections and biofilms from the fungi on the surface of medical devices represent significant threats to human health. Invasive candidiasis is a type of fungal infection that occurs when candida enter the blood, causing bloodstream infections and then spreading throughout the body. One form of invasive candidiasis, candidemia, is the fourth most common bloodstream infection among hospitalized patients in the United States. The symptoms of invasive candidiasis are not specific. Fever and chills that do not improve after antibiotic therapy are the most common symptoms. If the infection spreads to deep organs such as the kidney, liver, bones, muscles, joints, spleen, or eyes, additional specific symptoms may develop, which vary depending on the site of infection. If the infection does not respond to treatment, the patient's organs may fail and result in death. Invasive candidiasis is extremely rare in persons without risk factors. In persons at risk, invasive candidiasis may result when a person's own candida organisms, normally found in the digestive tract, enter the bloodstream. On occasion, it can also occur when medical equipment or devices become contaminated with candida. In either case, the infection may spread throughout the body. These are just a few things to know about Candida albicans and candidiasis. To learn more about environmental infectious disease testing services and prevention measures or other environmental concerns, please visit the website shown on the screen.
Are you tired of people calling you Spot? Well, then maybe you have tinea versicolor. It's one of the most common rashes caused by fungal infections, and it's easily recognized by its characteristic appearance of spots on the upper back and chest that look like Swiss cheese. It's very easy to cure, but so hard to prevent from recurring unless you know how to treat one special part of your body that doesn't even have the rash. Tinea versicolor, also called pityriasis versicolor, may sound like an exotic disease, but it's caused by a very common yeast called Malassezia globosa. I know, it was right on the tip of your tongue. And it occurs most commonly in young adults and adolescents in warm, humid weather. The rash is usually confined to the upper body, chest, back, shoulders, and upper arms. The spots tend to be smaller than a dime or a centimeter and are hyperpigmented in lighter skinned people and lighter than your skin color in people with dark skin tones. Usually there aren't any symptoms, not even itching, just spots. If you look real close, you may even see fine flaking at the edges of the spots. Because the yeast only lives in the most superficial layers of dead skin cells, it's easily treated with shampoo containing yeast-fighting chemicals like over-the-counter selenium sulfide and prescription ketoconazole. While treating with the shampoo is easy and efficient because you just spread the lather everywhere from your neck to your waist, you need to be patient and leave the lather on for 5 to 10 minutes every day for at least a week. That kills the fungus and thereby prevents spreading and new spots. But it may take months for the spots to disappear and for your skin color to return to normal. So it's easy to treat, right? But annoyingly, it so easily comes back the next time you're in hot, humid weather, especially if you sweat a lot. We think that most people carry the yeast or its spores on the hair of their scalp and can reinfect it from their own hair. So if you want your tinea versicolor to stay away, make sure you treat your scalp hair the same way I described for your body and let your friends call somebody else Spot. Please join me.